Good morning. My name is Marty Mascari. I'm with the North Central Texas Aging and Disability Resource Center. The ADRC is a project of the North Central Texas Area Agency on Aging under the North Central Texas Council of Governments. Welcome to our Medicare training, and we're going to jump right in. We've got a lot to cover. We've got three great speakers, and so I'm going to turn it over to Jan Henning. Jan Henning is the Aging Program Supervisor of Direct Services for the North Central Texas Area Agency on Aging, and she's going to get us started here. In just a second.
Good morning, everybody. Can everybody hear me?
I can hear you. I have muted the participants because of the background noise.
Okay, very good. Well, we're going to get started this morning. Like Marty said, we have a lot of information to cover, but we think that this is information that'll be really useful and important to you. So we're sure glad that you tuned in. And so the official title is Medicare Open Enrollment, Important Details Beneficiaries Need to Know for 2018. So as we do that, we'll do a little bit of background information as well. You'll notice on the overheads there's a lot of information. We may not go over each and every point, but you'll have these as a set of overheads that you can print out, and that way you'll be able to refer back to them if you want to double check anything or else dig deeper for other information. So
Jan,
yes?
I apologize. For some reason, it is not allowing me to turn it over to you, and so I'm just going to have to advance the slides.
Okay, very good. So we're ready for the next one. This, as we know, is a very important time of the year for Medicare beneficiaries. According to CMS, the official Medicare agency, and that stands for Centers for Medicare and Medicaid Services, this is the time of year when beneficiaries need to review, compare, and enroll. And we'll take some time this morning to fill out a little bit exactly what that means. But open enrollment starts October 15th, ends December 7th for coverage that will begin January 1st of 2018. And so when they say ends December 7th, they mean at 11:59 and 59 seconds p.m. People have actually to the end of the day to go ahead and make those changes. Another point I'd like to cover is the fact that these are the official CMS overheads, but I have sometimes combined different training modules and overheads so they don't flow exactly the way they would if you went to the CMS website and looked for them. Okay, but before we begin to get into open enrollment, I want to spend some time looking at two very important announcements. One being new Medicare cards, what's that all about? And then a second announcement, an opioid epidemic strategy as far as CMS is concerned. So related to new Medicare cards, and we can go to the next overhead, the important news here is that Medicare is going to mail new Medicare cards to every Medicare beneficiary between April of next year and April of 2019. And some of you may know that there are currently 57 million people on Medicare. So I did some math and lo and behold, discovered that that means they're going to be mailing out more than 1 million cards every week between now and then. So picture yourself at your local post office and, just be thankful for your mail carriers and mail processors because they're going to have to process and distribute by mail all of those new Medicare cards. And so what is the difference going to be? Instead of the Social Security number, there'll be a different number. This photo that you're seeing here is on the inside front cover of the new Medicare and You booklet, and it's also a flyer that doctor's offices will distribute. As we look at the next slide, we'll see a little more detail about the rationale. You may have heard the health insurance claim number being called the HICN, and that is the ID number that Medicare uses in order to process claims. So historically, that has been either the individual's Social Security number plus a letter, or it's been the Social Security number of the person upon whose work record that beneficiary is drawing benefits. But back in 2015, federal legislation required CMS to remove that Social Security number, basically because of the threat of medical identity theft. So new Medicare cards have to be mailed out by that deadline in 2019. And the important point as you talk to Medicare beneficiaries, because some of them will be confused and uncertain about this change, the important thing is that the new Medicare numbers don't change any of their Medicare benefits. So they can start using their new card right away when they get it. On the next slide, we'll see what the new Medicare card looks like. So it's still red, white, and blue, but a little bit more stylized than it was before. And then the important thing that we want to look at is what that identifier is going to look like. So remember, it was all numbers and then a letter. Now it's going to be numbers and letters interspersed. But you'll always be able to know exactly where the letters are going to show up. So it's 11 bytes instead of 9. And then those certain key positions will also always be letters of the alphabet. So that's what it's going to look like. So you have to figure, oh golly, they must create at least 57 million different number and letter combinations. And that's not to mention the people that will be on Medicare in the future. So it was more than I could figure out by myself, that's for sure. Okay, on the next slide, we'll see when they start sending those new cards. So if a person is new to Medicare, they're that newly eligible Medicare, they're going to get a card with that unique number starting in April, regardless of where they live. But existing current Medicare beneficiaries will get a new card over that 12-month time period. And if you jump down, you'll see the distribution is randomized by geography. So they'll get that new card and a letter with instructions. All existing cards will be replaced by April 2019. But actually, people can use their older card through December 31st of 2019. So if there's any confusion at all, like a beneficiary has both the new card and the old card, they can use either one. Preferably, they would start using their new card, but they have till the end of 2019 to use their old card. But once we hit January 1st of 2020, only the new card can be used. So the system won't recognize those old numbers. And of course, if anybody is part of the Railroad Retirement Board, they will follow suit in issuing new cards to their enrollees as well. On the next slide, we see that just some instructions that people with Medicare should make sure that they have their current address registered with Social Security, because otherwise they're not going to receive that card in the mail, and that could cause issues down the line. If anybody loses their Medicare card, they'll continue to be able to get a replacement card. And then, of course, identity theft and fraud are always potential issues. We'll hear just a little bit more about that related to Senior Medicare Patrol later in the presentation. But individuals, beneficiaries, can always get a new random Medicare number simply by calling 1-800-MEDICARE. So that's good to know. They can get a new number if they lose their current number. So here's where we see outreach and education. As I already mentioned, the Medicare and You 2018 handbook on the front inside cover. There's a heads up about the new Medicare cards that are coming, and then also on the Medicare calendar, when it comes to March of 2018, that page includes a reminder that all beneficiaries will be getting a new card. So here, once again, on the next overhead, we see what that page is going to look like in the Medicare and You booklet, as well as the flyer that will be provided to doctors' offices. So that's a very nice visual way of getting the message across. The next overhead shows us the website. And so right now they've already got that information posted prominently along with the new card. Over to the lower right side there, you see the Guard Your Card ad. And I've already seen a TV ad related to beneficiaries guarding their card and making sure they keep that number and that information to themselves. So as the year progresses, you'll hear more about the Guard Your Card ad. And then finally, there's a way to continue to get more information. It's on the next overhead, the Stay Connected information. You can always go to the website and get more information. The second important announcement that we wanted to talk about is related to the current opioid epidemic that we're experiencing here in the United States. And CMS, again, wants us to know that they're aware of this issue and that they are providing various coverage options for Medicare beneficiaries. But a little bit of background is really important. And on the next slide, we get a brief definition of opioids. They're a class of drugs used to reduce pain. They come from opium plants, sometimes called narcotics. And for those of us who are older, that was the common name. Opioids is a newer name for some of us. But some of the prescription opioids include the oxycodone, the hydrocodone, morphine, and methadone. And those are the ones that come from the opium plants. And then there's a synthetic opioid named fentanyl, which is more powerful than other opioids and treated for severe pain. And, of course, we all know that heroin is an illegal opioid. So, did you know that almost 2 million Americans either abused or were dependent on prescription opioids in 2014? It's kind of a startling statistic when you think about it. So I hope you're really paying, really tuned in to this information because it's not only for the clients that we work with, but in our everyday lives, it's for the people that we know and love too, that we want to be aware of the opioid epidemic as it's being called. Okay, there's another did you know on the next slide. An estimated 1 out of 5 patients with non-cancer pain or pain-related diagnoses are prescribed opioids. So it's getting to be very, very common. Here are a few more facts and figures. The 1.9 million, almost 2 million, is repeated in the first bullet point. But in 2014, second bullet point, more than 28,000 people in the U.S. died from overdoses of all types of opioids. So that means legal and illegal. But out of those 28,000, about half of them were due to prescription opioids. Heroin-related deaths have tripled since 2010, and the most commonly diverted drugs are opioids. So I had to look up what diverted meant, and so I put that in parentheses. That means obtaining a drug legally, but then diverting it to an illegal use. And here's a kind of a shocking statistic. Nearly 80% of individuals with an opioid use disorder don't receive treatment. So again, it's something that we need to raise our awareness of this. On the next overhead, we see, I think we may have skipped one. There we go. Individuals at high risk for overdose. If people take daily doses of opioids, if they doctor shop, that means going from doctor to doctor to doctor to get prescriptions. If the individual is using a combination of drugs or has a history of substance abuse disorders or mental health issues. So the client populations that we work with as an area agency on aging, and many of you being with nonprofits, your client base may tend to be the same. Individuals on Medicaid, individuals with low income, individuals in rural populations. All of those groups have a higher risk for overdose. And then here on the lower right, again, is another surprising statistic that since the turn of the century, sales of prescription opioids have quadrupled. So what is CMS doing about this? They've recognized that this is an issue, so they've developed some priority areas that apply to Medicare beneficiaries. So again, we're talking specifically about people enrolled with Medicare, not the general population. So they feel like one of their priority areas is to implement a more effective person-centered as well as population-based strategy to help reduce the risk of the disorder as well as overdoses, et cetera, and the other issues. Expand the use and distribution of naloxone, expand screening, diagnosis, and treatment, and that is by using Medicaid-assisted treatment, which we'll see in the next overhead, and then use evidence-based practices for pain management. So again, this MAT is specific to Medicare beneficiaries, where behavioral treatment is combined with medications. And so on the left side, physicians and providers may be treating through the use of controlled substances as well as non-controlled substances. And so all that to help reduce the dependency on the opioids. So Medicare, again then, what is the Medicare coverage going to be? Medicare will cover drug treatment for opioid disorder if the services are from a Medicare participating provider or facility. The doctor will need to state that services are medically necessary and set up a plan of treatment. Medicare will cover prescription drugs used for treatment, but it may depend on what part of Medicare. So Part A, if a person is an inpatient. Part B, if an injection used for treatment is at a doctor's office. And then Part D, if it's prescriptions are prescribed and picked up at the pharmacy. On the next slide, you'll see what the drug plans are required to do. They're required to cover a range of treatment drugs. And of course, coverage and rules can vary by plan, the same as with any other medication covered under Part D. And then the plans can also manage access. If you've listened to some of our other webinars, you'll know that Part D plans have formularies. They may have prior authorizations, step therapy, and quantity limits. All those can be used as a way to manage access to certain prescriptions. And then on the next slide, you'll see that here are some resources, websites that you can go to for further information. All right, so now we're ready to dive into Medicare open enrollment, and again, we're going to continue to emphasize those open enrollment dates. During this session, you will see that we'll cover the following information, and it's summarized for you on the next overhead. And that will be, we're going to look at key dates, choices, costs, original Medicare, prescription drug plan snapshot, Medicare Advantage snapshot, how to compare plans and join, and then some helpful resources. Once again, then, this particular open enrollment period offers several options for people. Sometimes we tend to think of it as just the time to join a Part D prescription drug plan, but it's also the time of the year when individuals can join or switch a Medicare Advantage plan, and those are the managed care plans that we'll discuss farther along in the overhead. So this is the time to review and compare not only drug plan choices, but the health plan choices as well, and then to choose and enroll the plan that best fits the individual needs for that coverage that's going to start on January 1st. And the open enrollment ends early enough in the year that individuals should have their membership card and materials in hand by the time January 1 rolls around. Here are some of the calendar highlights, and we've already passed some of these dates, but the important ones to focus in on, October 1st, the plans were able to begin marketing their 2018 plan options. The information is now available on the Medicare Plan Finder tool, although there are some minor tweaks still being made. This week, we generally do not start to do plan comparisons as an area agency on aging staff until sometime in the first week of open enrollment, because every now and then some of the information changes a little bit. You'll see the October 2nd date. Sometimes there are plans that choose not to be available the following year, so members have to be notified about that. There's also a star rating system on the Plan Finder tool, and you'll see the deadline for that being displayed. And then you'll see open enrollment dates. And then the final series of dates on there, January 1st to February 14th, indicates a special disenrollment period where individuals who are enrolled in Medicare Advantage can switch back to original Medicare. And so that's a special opportunity that comes around once a year, early in the year. Why is it important to compare plans? Because, and that is on the next overhead, Marty, so you're good there. Because plan costs do change, and sometimes premiums change, the deductible may change, co-payments may change. Coverage, the actual drugs that are covered by the plan can change. So every beneficiary currently enrolled in a plan has already been mailed an annual notice of change to give the individuals details about the next year's plan. Now, does that mean everybody sits down immediately and looks at it? Not necessarily. So that's where our role comes in as benefits counselors and an area agency on aging. We're able to assist individuals with that. And the point that we've already mentioned before, that some plans actually choose to leave the Part D program. Your choices on the next overhead are either original Medicare or Medicare Advantage plans. The other Medicare health plans you see there are not available in our area, so we just disregard those. But if you look to the next overhead, you'll see the diagram that's in the Medicare New booklet that's really very helpful in describing the differences in how people get their Medicare coverage. So there are two ways to get Medicare benefits. One is through original Medicare, which is on the left, and then the other way to get Medicare benefits is through Advantage plans. So on the left with Original Medicare, you see you get your A and B, hospital and medical insurance, and then related to Original Medicare, you have the option to either purchase a supplement policy, which is a Medigap policy, which pays some of the Medicare costs that are not covered, and then along with that, you have the option to enroll in a standalone Part D prescription drug plan. On the right side with Medicare Advantage, you'll see that you still get your A and B benefits, but it's combined into a managed care plan where you generally have a network of doctors and providers that you go to. And those are called Part C many times, and most times the Medicare Advantage plans offer their Part D drug coverage bundled into a plan. There are a few plans, and that's where you see the sometimes, but there are a few plans that don't provide drug coverage, and so individuals can enroll in a standalone plan in that case. Okay, so for 2018, and that's the part we want to look at, we still don't know what the premiums are going to be for Part A or Part B. We don't know the Part B deductible yet. The Medicare Advantage average monthly premium has been announced. It's right in the $30-some range. But the Medicare prescription drug average basic premium is $33.50. Okay, so, and this is just a... Yes, I'm hearing somebody. Okay, we're going to continue. And this is review for everybody how most individuals do not pay for Part A because of the FICA taxes that they've paid. So for most people, that Part A is premium free, but some people do actually buy it. For Part B on the next slide, most individuals do pay a monthly premium, and there can actually be a surcharge added to that depending on a person's tax return from 2 years ago and the amount of income that they have. So with the Original Medicare drug coverage on the next overhead, we see that again, it's not as simple and easy as simply saying, okay, all medications are covered by Part D. That's not the case. Prescriptions can actually be paid for by Part A, hospital insurance, Part B, outpatient insurance, or Part D. So it depends on the medical necessity and the health care setting and why the person needed that particular medication. So Part A does cover drugs covered during an inpatient hospital stay or skilled nursing facility stay, as well as medications used in hospice care. Part B then, on the next overhead, lets us know that in some cases, and that's really limited cases, that Part B will cover outpatient drugs. And mostly it's the injectable and infusible drugs or certain drugs and biologicals used for end-stage renal disease. In addition to that, some drugs used at home with durable medical equipment such as nebulizers and infusion pumps, and then some oral drugs related to cancer treatment or immunosuppressive drugs that are needed. Immunizations sometimes are confusing to beneficiaries because Part B covers most immunizations as part of its preventive services coverage, and so those would be the flu shot, the pneumococcal pneumonia shot, and the hepatitis B shot, or the tetanus shot if someone's had an injury or disease. In addition to that, if a person is in, let's say, an emergency room, but based on an outpatient setting, and there are certain self-administered drugs that they generally take, Part B does not cover those unless needed for those hospital services. So in some cases, if the beneficiary goes ahead and authorizes that drug, he may be billed for those, and so he may have to pay for those and then later submit those for reimbursement to the Part D plan. On our next overhead, again, we're going to see that the estimated average basic premium for Part D is $33.50. There are many plans that are lower than that, many plans that are more expensive than that in terms of premium, so just keep in mind that this is an average. The next bullet point is a reminder that the donut hole keeps shrinking every year, and it will finally disappear in the year 2020. And then the other figure that we need to know is the base beneficiary premium, and that's $35.02 for next year, used to figure the late enrollment penalty. Okay. And here we just see the chart related to that surcharge for the Part D premium. So let's talk about covered drugs. Again, very briefly on the next overhead. You'll be able to come back to this later as need be, but brand name and generic drugs are covered. Coverage and rules vary by plan. But on the next slide, we'll see that there are certain groups of protected categories that all plans are required to cover. On the next slide, we'll see the basic rules or guidelines that Part D follows. It's optional. All plans have formularies. Generally, individuals pay that premium, deductible, and co-insurance. But there is an extra help program for individuals with limited income and resources, and that pays some of those costs. If you wish to join Part D, you only need to have Medicare Part A or Part B. You can have both, of course, but or is acceptable also. You do have to live in the plan's service area and follow some of those other rules as well. Generally, individuals can enroll during their 7-month initial enrollment period, and then the time we're focusing on this year is the open enrollment period. At times, there are some special enrollment periods as well. Moving along to choosing a Part D plan, individuals, of course, can go to the Medicare Plan Finder, which Mary Jane is going to give us a walkthrough on in a little while, or you can call Medicare at their toll-free number that they answer 24 hours a day, 7 days a week. And I always tell people in the middle of the night, if you can't sleep, get up and call Medicare and see who's there. So they'll be happy to help you with any Medicare questions you might have. It's also important to, if we could go back for a second, it's also important to contact your state health insurance assistance program, SHIP, and that happens to be us, the Area Agency on Aging. And then here are the options for actually enrolling in a plan. You can go to the website, you can call 1-800-MEDICARE, go to the plan's website, or complete a paper enrollment form as well. The decision people have to make is, should I enroll in a Part D plan? Let's say I'm new to Medicare, or I haven't needed any prescriptions and I'm on Medicare. Should I enroll in a plan? Well, a question I have to ask myself is, do I have creditable drug coverage through another source, such as maybe I have a husband who has employer coverage? And of course, that creditable coverage means it's as good as Medicare's coverage. I need to think about whether or not that coverage is going to end when either I retire or my spouse retires. I also want to look at costs and factor that in as well. So if you don't have creditable coverage, you may be subject to a penalty later on. So if you do have other coverage in the next overhead, we're getting that caution signal that we want to make sure that we check with that plan before we make any changes, because if we simply disenroll for ourselves, we may be losing coverage for our dependents as well, and maybe we don't intend to do that. Let's take a look at Medicare Advantage plans. That is that second or alternate way of getting Medicare benefits. So these are health plans that are approved by Medicare. They're still part of the Medicare program, but they're run by private companies instead of the federal government. So sometimes people will ask, well, how can they only have a premium of $25 a month or no premium? And the answer is simply that Medicare is paying the plan a specific amount for every enrollee that they have for every month that that person is enrolled. And based on that payment, the Medicare Advantage plan is providing health benefits to that individual. With many of them, you are required to use their network of doctors or hospitals. So there are various types of plans available, which again we're not going to go into in today's session. But important reminder is that individuals are still in Medicare with all of the rights and protections of Medicare. They still get those A and B services. They may choose a plan that provides prescription drug coverage if it's not bundled in. And then sometimes those Medicare Advantage plans have extra benefits like vision or dental benefits. And those are not benefits covered by Medicare, but they're offered by the plan at their expense. What are the time frames that a person can enroll in Medicare Advantage plans? Well, generally during their initial enrollment period, but also, again, the time frame that we're focusing on, which is the open enrollment period. So in order to do that, they can either call the plan's telephone number, go to the website, or again use the Medicare Plan Finder tool. So just emphasizing again that a person can switch and join a new plan. When that happens, the individual enrolls in the new plan, and that automatically disenrolls them from the old plan. If a person doesn't want to enroll in just another Medicare Advantage plan, they can switch back to original Medicare and then enroll in a standalone drug plan so that they get that drug coverage. Because remember, if drug coverage is bundled into that Medicare Advantage plan, when they disenroll from that plan, they're disenrolling from their drug coverage. So it's really important for them to consider the fact that they need to enroll in a standalone plan. And again, check with their benefits administrator. Okay, if a Medicare plan does not renew, and we've really already covered this point, but they are required to notify their members. But in this case, those beneficiaries have a special enrollment period that starts the same day as open enrollment but extends all the way into the new year and ends at the end of February. So there's a longer time for those individuals who are in non-renewing plans. And so again, there's a decision, should I join a Medicare Advantage plan? Well, all individuals have to be in both A and B to join Medicare Advantage. We already covered the point that most of them include the Part D coverage. Many of them require you to use a network, and you may need a referral to see a specialist. With Original Medicare, you can go to a specialist, make an appointment at any time that you want to. With Medicare Advantage plans, generally it has to go with the primary care provider, who then writes a referral to see a specialist. You still pay the Part B and the monthly plan premium if you're in a Medicare Advantage plan. And again, you have those certain times when you can join or leave the program. If you're in Medicare Advantage you cannot have a Medigap policy. It's against the law for anyone to sell that to you. And most of the Medicare Advantage plans are not open to people with end-stage renal disease, but in the next few years, stay tuned because that is going to begin to change. If you have other coverage, again, just this important note to make sure that you check with your other benefits administrator about that coverage and what happens when you're switching your Medicare coverage. This next overhead is simply a comparison summary of how original Medicare works compared with Medicare Advantage plans, so we'll leave that to you to look at later on. And then the next overhead is a brief reminder about Medigap and open enrollment. And here the important note is that if you're in a Medicare Advantage plan and you drop it to go back to original Medicare, there's no guaranteed right to buy a Medigap policy unless you happen to be in a trial right period, and that will be explained in the Medicare and You booklet. So plans may or may not be available to you. And then, of course, you can go to the Medicare Plan Finder to get Medicare Advantage information. You can go to a plan's website, look in the Medicare and You handbook, call 1-800-MEDICARE, and, of course, call us, the State Health Insurance Assistance Program. We're the official SHIP for North Central Texas. Here's our telephone number, and you want to call that and ask for a benefits counselor. So what Medicare recommends, and we're going back to those same 1, 2, 3, 4, 5 that you saw on the previous slide. Using the Medicare Plan Finder is really an effective way to see what plans are available. And so now at this point, I'm going to turn it over to Mary Jane, and she's going to walk us through the Plan Finder tool.
Jan,
Thank you, Jane.
Mary Jane, I'm going to take just a second if I could. Those of you that are online that are looking to get CEUs, if you will email me, just email me the word Medicare, and that will get us going. Go ahead, Mary Jane. Thank you.
Okay, if you can forward the slide, Marty. Okay, so we're going to briefly go over navigating the Plan Finder, if you'll forward it. And so the Plan Finder is a tool that we as SHIP benefits counselors use to do our plan comparisons. It's located on the Medicare.gov website. You can do several things on the Plan Finder. You can view and compare Medicare Advantage plans and standalone drug plan options in your area. You can identify which plans cover your prescriptions at the most affordable price at the pharmacy that you choose. And you can also enroll in a Medicare Advantage plan or a standalone drug plan. So Medicare open enrollment, as Jan said, begins October the 15th. And so you can preview the next year's plan data starting October the 1st. So right now on the Medicare Plan Finder, 2018 plans are online, and you can preview them. But as Jan said, we don't like to do plan comparisons until after October the 15th because they're still tweaking the website. So the Plan Finder will display the current year and the next year's plan data. So there's 2017 and 2018 plan data online. And the current year data will continue to display until November the 30th. So you can still enroll in 2017 plans until November the 30th. And then after November the 30th, the 2017 plans will not be visible on the Plan Finder. So you're going to need some information getting started to do a plan comparison. So you're going to need your zip code, your Medicare number, your list of prescriptions, the strength and quantity, and whether you can use generics or not, the pharmacy that you prefer to use, what health insurance or Medicare insurance that you have, and if you're eligible for a subsidy, also known as extra help. And so this is the home page of Medicare.gov. And so there's a couple of different ways that you can access the plan finder. So up there on the blue bars, you can sign where it says sign up/change plans. You can click on that to access the plan finder, or on the green bar, find health and drug plans. You can click on that to access the plan finder. And you can do the search or the plan comparisons in English or Spanish. So up there in the left-hand corner, you can choose either English or Spanish. And so this is the search page of the plan finder. There's some other tools on this page. There on the blue bar, you can click on frequently asked questions. And you might have some questions that might be answered by looking at the frequently asked questions. I think these were questions that were asked by SHIP benefits counselors. And then down there, it's really kind of hard to see. It's such small lettering, but where that red arrow points to additional tools, maybe you're looking for a PACE program that might be in the area. Of course, we don't have PACE programs in this area. Or maybe you want to look up the plan by the name of the plan, or you actually can enroll in a plan. There's an Enroll Now, I think about the fourth bullet point down. And then at the bottom, just some more related resources. So anything with blue lettering or the blue bar with the white lettering, or sometimes purple lettering. If you'll click on that, then you can expand and get more information by clicking on the blue lettering. Okay, you can forward it. So this is the search page, and there's two kinds of searches that you can do. A general search by just entering in the zip code, or a personalized search. And for the personalized search, you're going to need a little more information. So you'll need the zip code, the Medicare number, and do not enter in the dashes when you're entering in the Medicare number. The person's last name, their effective date for Part A, or you can do Part B. You can toggle back between those two. And then their date of birth. So I like to do a personalized search whenever possible, and it's especially helpful if someone doesn't know what plan they're on, or they don't know if they're on extra help or not, and believe it or not, that happens quite often. So next slide. So if you do the general search only, you're just entering in their zip code, then this is the page that's going to show up, and it's going to ask you a couple of different questions. How do you get your Medicare coverage? Are you on original Medicare, or are you on a Medicare health plan or a Medicare Advantage plan? So this person has chosen that they're on original Medicare, and then they have checked that they have a separate drug plan. And then they're going to ask, are you getting any help with your Medicare prescription drug costs? So are you on SSI Medicaid or Medicare Savings Program? And this person has checked that they are on extra help, and they are on partial subsidy, so they're only paying 50% coinsurance for their drugs. And they really weren't sure of what percentage their monthly prescription drug plan premium was. So it can be either 0, 25%, 50%, or 75%. So they didn't really know that, so they didn't answer that question. And then you'll want to click on Continue Plan Results. And so the next slide. And so again, if you're doing a general search only, then they'll want to know what is the name of the plan that you're enrolled in. And so this person checked the AARP Medicare RX Preferred Prescription Drug Plan. Some people don't know what plan they're enrolled in, so you would just click on I don't know what plan I have. Or if you're doing a plan comparison for someone that maybe has moved from another state and their plan is not listed in that list of drug plans, then you would just click I don't know also. And then you would click on the brown bar that says Continue. And so now we want to enter in our drugs. So if you did a personalized search, this would be the next page that would show up. And up in the upper right-hand corner where it says My Profile box or My Current Profile, it's really hard to see, and I apologize about that. If you did a personalized search, this would have automatically filled in what their current coverage was, and so it would have shown whether they were on a Medicare Advantage plan or just a standalone drug plan, their current subsidy, so if they were on extra help and what level of extra help, But this person actually manually entered in that information because they just did a general search. And then there are some people that are not taking any drugs, or maybe they don't want to enter their drugs right now. They just want to go look at the list of plans that are available in the area. So kind of above those two bars, above the green line boxes, it says, I don't take any drugs, or I don't want to add drugs now. You can click on that and just skip the drug entry. And then if your drugs had been previously entered into the drug list, then if you did a personalized search, it would automatically show up under their whatever medications had been entered in, and it would have a drug list ID number assigned to it, a password date, and a zip code. And so the next slide. So this is how you enter medications into the drug list. And so you want to type in the name of the drug, and usually you can type in 2 or 3 letters, and then there's a drop down, and they'll display all the drugs that start with those first 2 or 3 letters, and you can click on the appropriate name of the drug. Or if you cannot find your drug, you can also just click on the letters of the alphabet of the first letter in the drug and do a search that way. And then after you enter in the name of the drug, you'll click on Find My Drug. Then over on the right-hand side, if you had not entered any drugs, as soon as you enter in one medication, it automatically assigns it a drug list ID number, a password date, and then, displays your zip code. So you might want to write this down if it's your drug list, so you can access it at another time, so you don't have to enter in your drugs again. You can just enter in the list ID number and password date and zip code and access your list of drugs. And then next slide, Marty. After you enter in Lipitor, then right to the side of Lipitor, it's Find My Drug. There's a little bar, Find My Drug, and so this is what it will display. So Lipitor comes in several milligrams, dosages, and so this person is taking Lipitor 10 milligrams. The quantity is 30, so once a month. The frequency, they're getting it filled every month. And the pharmacy type, they're getting it filled at the retail pharmacy. So you just click what's appropriate, and then you click Add Drug and Dosage. So if that person was getting it filled, maybe the doctor wrote a prescription for 3 months' worth, then the quantity would be 90, and then the frequency would be every 3 months, and then the pharmacy type, either they're getting it filled at the pharmacy every 3 months, or they could be getting it filled through mail order. So you just click off what's appropriate. Okay, next slide. So again, after you enter in the medications, it automatically assigns, after the first medication, it automatically assigns it a drug list ID number, a password date, and enters in your zip code. Lipitor is a brand name, and so it does have a generic available. So what will happen if you enter in a brand name, automatically there'll be a pop-up box, and it will say, do you want to enter the brand name or do you want to enter the generic? And it will give you the generic name. So this person's decided they want to enter in because they're taking the generic. So that atorvastatin calcium is the generic for Lipitor. So if you look at that red box, atorvastatin calcium tab, 10 milligrams, and kind of run your eyes across, there where it says generic options, it says already generic, you originally entered Lipitor, and then it says switch back. So if the person calls you back and says, oh, my doctor just wants me to take the brand name, doesn't want me to take the generic, then you can click on that switch back and it will automatically switch it back to Lipitor. Or if the person calls you back and says, oh, I'm taking 40 milligrams, not 10 milligrams, I made a mistake, then you can click on to the right there underneath the action column, click on change dose, or maybe they want to remove that drug, so you can click on remove, or maybe they want to add something. And then when you've completed the drug list, then you click on the brown bar there at the bottom that says my drug list is complete. Okay? So on this page, you want to select your pharmacy. So you can select up to 2 pharmacies, And so in the green-lined box, in little bitty letters, if you can read it, it says, we found 7 pharmacies within a half a mile of your zip code. So if you don't find the list or the pharmacy that you're using, right there by half a mile, there's a little down arrow, and you can click on the down arrow and expand the search. And then if you still can't find your pharmacy, then underneath that line in a little bar it says search new location or by pharmacy name. So you can click on that and do a search. And then over to the right, that little bar says show or hide pharmacy map, and you can actually see a map of where the pharmacies are located. Oh, hold on. But go back, if you would, Marty. Back one more. Okay. So once you enter in your drug list, my current profile box up in the right-hand corner, now it's going to include that information, your drug list ID number, and your password date. Okay, now you can change it. Okay, and so this is clicking on that show or hide pharmacy map, and that just shows you the map of the pharmacies where they're located. Okay. So the next thing you're going to do is refine your plan results. So you need to decide, do you want to do just a standalone drug plan comparison, a Medicare health plan with drug coverage, or a Medicare health plan without drug coverage? And Medicare health plan and Medicare Advantage plans are the same thing. And so over on the left, you have the choice to filter or refine your search. And so maybe you or the person that you're doing the search for wants to, it's really important that they get a plan with a high star rating. So there where it says select star ratings, there's a little plus sign, and you would click on that, and it would have a drop-down menu and tell you how you want it sorted, and you would just click on how you want it sorted, and then update plan results there at the top, and it would sort the plans by the star ratings. The one that I probably use the most is select special needs plans, and I would click on that plus sign, and it would show me the special needs plans for those with that are currently on SSI, or plans that are for people with SSI or QMB benefits, or people with chronic illnesses such as diabetic or congestive heart failure. So quite often I'll do a search for special needs plans for people that are on SSI or QMB, and so I would click on that and then update your plan results. And so it would include in my plan results the special needs plans. Sometimes it doesn't have any special needs plans that are available in the area, or it might not have a special needs plan for maybe the people that are on SSI and QMB. So, and that, if it doesn't have a plan, the little checkbox will kind of be grayed out. So, and then once you've decided and set how you want to refine your plan results, then you click on that brown bar, Continue to Plan Results. And then these are the symbols that Jan kind of spoke of in her part. There, that star, that little star with the kind of yellow gold background, that is a 5-star rating plan. So the plans are rated from 1 to 5 stars, and a 5-star rating is the best. If you're on extra help or low-income subsidy, you can change your plan anytime you want. But if you're not on extra help, you're locked into your plan for a whole year. You do have the option to join a plan outside of Medicare open enrollment if you're switching to a 5-star plan, and you can do that one time within the calendar year. And then those little circles down there, some dental, some vision, some hearing, those would be symbols that would show up on your Medicare Advantage plans if they offer those benefits. And then the nationwide coverage, the blue circle with the white N, those would show up either on Medicare Advantage plans or on drug plans. And so that would show that that plan is probably offered nationwide. Maybe not in every zip code, but there's a possibility you would be offered in other states. So if you travel a lot, you might want to consider a nationwide coverage plan. Down at the bottom, if you click on the plus sign, it'll give you the details of your current plan, or if you're wanting to view the star ratings of the prescription drug plans or Medicare Advantage plans in your area, then you would click on the plus sign and that would expand out and give you the details. Okay? And so this is looking at the star ratings of the plans. There's a couple of tabs. If you click on View Summary Star Ratings, it will actually give you the star ratings of the plan. And over on the right, if you click on that tab, View Drug Plan Star Ratings, it actually gives you the criteria that they rate the plans on. So whether they're complaints or customer service or experience with the drug plans, it'll give you all that information. Okay? This is really hard to read, but on the page, when you're doing the plan comparisons, if you see lower your drug cost, if you'll click on that, it will make suggestions on how to lower your drug cost. So if you have a name brand drug entered in your drug list, it will make the suggestion that you could, if there's a generic available, maybe you could change to the generic. Or if you're taking a very expensive medication, it might suggest that you could check a prescription assistance program that might help with the copays on that medication. Okay? And so this is just looking at a drug plan, just pulling up one plan. You can compare 3 plans at a time, but this is just pulling up one plan, and it's SilverScript Choice Prescription Drug Plan. And so it displays your fixed cost, which would be your monthly drug plan premium and your annual drug deductible. The monthly health plan premium is not applicable because we're just looking at a standalone drug plan. And then down there, the second red box where it says estimate of what you will pay for drug plan premium and drug cost. So this person chose Hammer Pharmacy, and this number right there, that $180.05, that gives you an estimate of what you're going to pay if you were to join that plan and get it filled at Hammer Pharmacy from the date of enrollment till the end of the year. And that includes paying the monthly premium, paying the copay, satisfying the deductible. It takes everything into consideration, and it's giving you an estimate of what your cost is going to be till the end of the year. And this does calculations that I could never do on my own. So this number is really important. And then it gives you your estimate if you were to use mail order pharmacy. Sometimes mail order is cheaper, sometimes it's not. Okay, and down at the bottom it says down at the bottom it says what you pay. And you can see there's 2 tabs. So if you, it's got mail order pharmacy circled, but if you look there on the left, it says the other tab is mail order pharmacy. So if you, Hammer Pharmacy. And if you click on Hammer Pharmacy, it's going to tell you, first of all, if that pharmacy is a standard retail cost-sharing pharmacy or if it's a preferred pharmacy, and you will get better prices at preferred pharmacies. And then underneath there, it's going to tell you all the drugs that you entered into your drug list. It's going to give the full cost of the drug. It's going to give what your cost is going to be if the plan has a deductible, what your cost is going to be in the deductible phase, what your cost is going to be after you satisfy the deductible, what your cost is going to be if you go in the donut hole, and what your cost would be if you come out of the donut hole and go into catastrophic coverage. So it gives a lot of detailed, really good information. Okay. And so if you scroll on down, this purple lettering, View Drug Benefit Summary, if you click on that, that will tell you if what your cost would be if you were to use a standard retail cost pharmacy, or what the difference would be if you used a preferred retail cost pharmacy. Okay. And so this is kind of looking at a Medicare Advantage plan, this Health Alliance Medicare Guide Plus, HMO, and it's got 5 tabs up there, and if you click on the Overview tab, it will give you the star ratings of the plan. If you actually want to go to the plan's website, you can do that. In that red box, it says View the Plan website. On the Plan Finder, where that red arrow is, you can actually see how many physicians or providers are in the area. that are in the plan, and then underneath it says View Provider and Physician Network website, so you can click on that. But I would highly suggest, if you're doing a plan comparison for yourself or for someone else, that if they're going to join a Medicare Advantage plan, don't depend on that information that's on the website. You really need to call your doctor and check with your doctor and make sure that they accept the Medicare Advantage plan that you're thinking about joining. Okay? And then this is looking at the Medicare Advantage plan again, the health plan benefits. It details out what your costs are going to be. If you go further down, it'll tell you what your copays are going to be. Your choice of doctors there where it's circled in red, plan doctors for most services, so you're in an HMO, so you're going to have to stay within the network of doctors. And then optional supplemental benefits, it says no. So if you'll look up, it says up by the name of the plan and kind of down a little bit, it does offer some dental, some vision, some hearing. So optional supplemental benefits might be that some plans might offer an optional dental plan that you can purchase at an additional monthly premium that might give you expanded benefits. So my guess is this plan would not offer any expanded benefits or supplemental benefits. Okay? Just go on and skip over this one. Go to the next one. So this is the format that I'm used to looking at. So I'm comparing three plans side by side. And this is comparing three HMOs. Right underneath the name of the plan, there's letters and numbers in parentheses. And so if the person wants to enroll themselves in the plan, I think it's important, this is a specific ID number of the plan, and it's important that this person, when they're calling in to enroll in a plan, they mention the specific ID number of the plan, because a lot of the plans have similar names. So you look there on the second and third column, there's AARP Medicare Complete Plan 1 and Plan 2. So you could easily get those mixed up, and you want to make sure that you're going to enroll in the plan that, you know, provides the benefits that you're interested in. So that's the specific ID number, and then it gives you the members, if you're a member, the number that you would call, or if you're a non-member, the number that you would call. And then there's the three little circles, whether they offer some dental, some vision, some hearing. You'll see over on the right the AARP Medicare Complete Plan 2 doesn't offer any dental. And then there's the enroll button, and that's what I use if I've been talking to someone, explaining the plans, and they decide they want me to enroll them. I can enroll them on the Plan Finder, and I just click on that enroll button and go on with the application. Fixed cost, and we actually have the tab at the top. We're looking at the drug portion of the plan. So the monthly drug premium, if you look in that first column for the Health Alliance Medicare Guide Plus, their monthly drug premium for this plan is $4.10. The health portion of the plan premium is $4. And so this person would actually be paying $8.10 a month in the premium for this plan. The middle plan, there's no monthly premium for the drug portion. There's a $13.20 premium for the health portion, so they would be paying $13.20 a month. And then the plan on the right, they would pay zero premium. And then all of them have a $74 deductible for the drug portion of the plan. Okay? All right. And if you scroll on down on the same page, there is, again, your cost at Hammer Pharmacy. So we talked about this. This is your estimated cost of what your medications would be from the day of enrollment to the end of the year, and that's including paying the monthly premium, paying the co-pays, satisfying the deductible, taking everything into consideration. And that is considering that you get all the drugs that you mentioned on your drug list. You're going to get them filled once a month, every one of those. And so it's just an estimate. And then down at the bottom is cost at your mail order pharmacy. And then when you look down, they don't have this noted, but I think it's good to mention where it says monthly drug cost in retail pharmacies. In those purple letters, View Drug Cost Summary. This is what I use a lot. You click on that, and that brings up all the pharmacies that you entered. If you entered 2 pharmacies, it'll tell the pharmacy, the name of the plan, the retail cost of the drug, if the plan had a deductible, what your cost would be, in the deductible phase after you satisfy the deductible, if you go in the donut hole, and if you come out of the donut hole. So that's real important information. And then down below that, it's giving you an estimated cost of what you would be out-of-pocket cost if you were to join the plan the first month, and it looks like the first month in all of those plans, they're meeting the deductible, so your costs are going to be a little bit higher, but they've met the deductible in the first month of the plan, and so the second month, there's what your copays estimated would be, and that includes paying the monthly premium, and the third and the fourth and so on. Okay. And so again, here's enroll in this plan. There's the enroll button. So in several places on the website, there are they give you access to enroll. And just make sure if you are going to use the enroll button, make sure you're enrolling in the correct plan. And then once you click on that enroll button, there on the right-hand side is the application and the first page of the application of enrolling in a plan, whether it be a Medicare health plan or drug plan on the Medicare Plan Finder. Okay. And if you're on the search page, we of course went over this really quickly, but if you're wanting to really get more information or education on how to do a plan search, there on the search page on the right-hand side it says Plan Finder Multimedia. There are tutorials that you can access that really walk you step by step on how to do a plan search. Okay. And I'm going to turn it back over to Jan to talk a little bit more about Medicare Open Enrollment.
Thank you, Mary Jane. And I realized I did not give you a proper introduction, so let me do that after the fact. Our presenter was Mary Jane Douglas. She's one of our seasoned benefits counselors. And as you can tell, the ease with which she went through the plan finder information, you can tell she is a pro at doing this, as are both Melinda Gardner and Cheryl Wynn, our other full-time staff benefits counselors. So we're real proud of our staff here and their ability to do drug plan comparisons for individuals. So we're happy to have any of you listening send client referrals to us, or if you just have questions about working through the plan finder yourself, we're happy to answer any of those questions, and we'll give you contact information at the end. So, okay, Marty, going to the next slide, and we're back to our numbers that and this was different ways to get drug plan information, and the first was going to the plan finder. The second is contacting the plan itself. So every health plan and every Part D plan has a website where you can get more detailed or comprehensive information. The limitation of going to the website of these individual plans is they're only going to provide their own information. So the real value that the plan finder has is that it does not play favorites at all. It's going to give you a comparison of all the different plans available. And of course, over the years, we've found that most people are interested in lower cost. So you can sort the plans that way. But then you have some people interested in having no deductible or low deductible, and that's more important to them than some of the other issues. So you always do have that option, though, to go to the website. And, of course, all the plans are listed in the back of the Medicare and You handbook if you have the Texas version. So with the Medicare and You booklet, there are two versions. One is a national version that doesn't have any of the plans in the back, but the Texas version does. Okay, so next, after contacting the plan, is to actually use that handbook. And here you see a small insert of what that looks like. Each year that's mailed to the household of every beneficiary, and so it's good for getting an overview of the plans. And then again, if you have the Texas version, you can see what plans are specific to Texas. But as the overhead points out here, the information is not comprehensive. Medicare also wants to point out that when they do that quality rating, that is based on consumer opinions. So look at the note at the bottom, and it will reemphasize that when you see the members' rating of the plan, the quality rating is based on what the members think. Medicare also does its own independent analysis of plans and takes into account a lot of different variables, and that's the basis of how Medicare sometimes suspends plans or even terminates certain plans. So that mailing has already taken place, so beneficiaries should already have their new booklet. The fourth way of getting information on the next overhead, it will explain that you can call 1-800-MEDICARE, and you can say your Medicare number if you have that available. That's helpful, or say the word agent at any time, because it does tend to get to be sort of a lengthy voicemail, and obviously it will answer with a recording. Two notes: that toll-free line is closed on Thanksgiving Day, which is during open enrollment, and Christmas Day, which is after annual open enrollment. The week after Thanksgiving tends to be the week when Medicare gets the most calls about drug plan choices. They are able to support individuals in 250 different languages. So someone can call that 1-800 number and then state that they have a language preference and then be connected that way. Here at the Area Agency on Aging, we also have the ability to connect to foreign language translators. So what can new members expect once they've enrolled? Let's say they've gone through this whole process. So on the next slide, we'll see, I passed right over contacting us. Okay, so again, emphasizing that North Central Texas Area Agency on Aging provides free health insurance counseling. We are unbiased. We do not say you should enroll in this or you should do this. We simply provide the information that empowers individuals to make their own decisions about their plan choices. So on the very back cover of the Medicare New Handbook, you'll see the Texas toll-free number. It's the 1-800-252-9240. That number actually rings down in Austin, and then it bounces back to the specific area agency on aging where the individual lives. But other than that, you can call our separate toll-free number and ask for a benefits counselor. Now we're moving along to what new members can expect. So let's say they've gone through this whole process, and on the evening of December 7th, they've enrolled in a drug plan. What can they expect? The plan is going to send them an enrollment letter, specific membership materials, including a membership card with their own enrollment number that they'll be able to use, and then also contact information for customer service. If a person's current drug isn't covered by that plan, they are entitled to get a transition supply that generally will be for about a 30-day prescription. And then that individual enrolled in that plan needs to work with their provider, their prescriber, to find a drug that is covered under that plan. But if there's no acceptable alternative, the provider can request an exception and see if the drug plan will approve that. What would happen if somebody needs a prescription before they get their membership materials? Let's say it's delayed, or let's say they've been out of the area and the new plan year has started. Well, what that beneficiary wants to do is to take as much information as possible with them when they go to the pharmacy. So take the person's Medicare card, a photo ID, the plan membership card if they have one. Any kind of acknowledgement or confirmation letter will be helpful to that pharmacy in trying to track it down. If the person is on Medicaid, they should take that card or letter with them, showing the pharmacy that they're eligible for extra help. And if all that doesn't work, the individual always has the option of paying out of pocket and then working with their Part D plan to get reimbursed at a later date. I mentioned early on that there is a special disenrollment period at the beginning of the year, and you may wonder why this is, because it's related to Medicare Advantage plans only. But it turns out that every fall during open enrollment, individuals enroll in a Medicare Advantage plan and they're not really aware of the fact that they're doing that. They haven't checked with their doctor to see if the doctor accepts that Medicare Advantage plan. So as it turns out, they will have a doctor office visit sometime in the early part of the year, only to find out that that doctor does not accept that Medicare Advantage plan, and that based on that, there's no coverage for that doctor office visit or any of the treatment that might be related to that. So because that has tripped up so many people, there's a special time period at the beginning of the year when an individual can leave a Medicare Advantage plan and switch back to original Medicare. So that time period is January 1st through February 14th. Now, a person cannot leave one Medicare Advantage plan and enroll in another Medicare Advantage plan. The person cannot be somebody who's in original Medicare and decide they want to be in a Medicare Advantage plan. It's only related to leaving a Medicare Advantage plan and going back to original Medicare. As we already noted, then they'll want to look at enrolling in a standalone Medicare prescription drug plan to add that coverage. And that would begin the first of the month after that new enrollment takes place. And again, there's no guaranteed right to enroll in a Medigap plan unless there are special circumstances. So that's something to consider as well. Our next important section that we want to talk about is Senior Medicare Patrol, because there's the potential for fraud and abuse during open enrollment time, especially as related to the new Medicare cards. So it's really important to be aware of Senior Medicare Patrol, what it does, and what its value is to Medicare beneficiaries. So I'm going to ask Melinda Gardner to provide us with some information about Senior Medicare Patrol. And Melinda, as I've mentioned, is one of our seasoned benefits counselors. You'll find that she's a treasure of knowledge and information. So go ahead, Melinda.
Thank you, Jan. The Senior Medicare Patrol is actually funded in part by the Administration on Community Living and Health and Human Services. And I guess we're giving a shout out to Little Elm Senior Center, but this call is not sponsored by the Little Elm Senior Center, but I'm sure they will appreciate the publicity that we're providing to them. Medicare fraud, errors, and abuse affects us all. I'm sure if we did a poll, we would find that some of you on the call have Medicare. Some of you may be caregivers, but all of us are actually taxpayers, so therefore it affects us all. And there are billions of taxpayer dollars that are lost to improper claims. And when those dollars are lost to improper claims, that does affect the Medicare Trust Fund and puts it at risk for those that are currently on Medicare, as well as those that will be on Medicare in the future. So it's up to everyone to make sure that we're doing what we can to help reduce that fraud and abuse. If not, then we can potentially see higher premiums, which many people have seen in the last few years. There would be less money for needed benefits, and then also the quality of care may go down. And so on the next slide, it talks about the consequences of Medicare fraud, errors, and abuse. Identity theft, and that occurs when a Medicare number is misused, either by a provider, a supplier, or by someone posing as the real beneficiary in order to receive medical care. There have been indictments that have happened with medical providers as well as people on Medicare. So when this happens, such Medicare numbers are considered compromised, and Medicare numbers are for life, or they used to be. With the new Medicare number, that is changing. So the identity theft could affect someone on Medicare as well as a provider. We can also look at the health impact. Receiving health care from a fraudulent provider can mean the quality of the care is poor. The intervention is not medically necessary or worse. The intervention is actually harmful for the person. And a beneficiary may later receive improper medical treatment from legitimate providers as a result of inaccurate medical records. Additionally, because of the inaccurate or fraudulent claims to Medicare, beneficiaries may be denied needed medical benefits. So if someone needed, for instance, durable medical equipment, and they went, or say they did not need durable medical equipment, but they did get a prescription for one, received the equipment, and later on needed that equipment, they may not be able to get that through Medicare because Medicare has already paid for one. So that's why it's important to make sure that is something that is medically necessary before actually receiving that. And then also we look at personal financial losses if Medicare numbers are used with the new Medicare cards. If a card is lost or stolen, a new number will be issued. And so that will lessen the personal financial losses. However, it may cause more rooms for errors with the medical providers because they have to make sure that they enter those numbers accurately. And it's more important than ever for beneficiaries to review their Medicare summary notice and make sure the services that they received are for them on their Medicare summary notice. So what is the Senior Medicare Patrol? What we do is we help Medicare beneficiaries prevent, detect, and report health care fraud. And this helps preserve the integrity of the Medicare program. And we do rely a lot on volunteers. As stated in a previous slide, over 5,000 volunteers nationwide that help with the Senior Medicare Patrol. So if we look at what Medicare fraud is, the word that sticks out is intentional. And if someone intentionally bills Medicare for services that were not received or billed at a higher rate than is actually justified, that is considered Medicare fraud. So it's the intentional billing which is inaccurate. And then if we look at what Medicare abuse is, it is providers supplying services or products that are not medically necessary or that do not meet professional standards. And some of you may know of maybe diabetic shoes, where someone is selling diabetic shoes and it's not a specific prescription for the beneficiary. And so that may be not meeting professional standards. something to look out for, whether it be a medical provider or whether it be a Medicare beneficiary. So here we have some examples of fraud and abuse, and we've talked about some of those already. The improper coding to obtain a higher payment, that could happen, and it could also be an error. Sometimes that happens where just the wrong stroke of a key will cause an incorrect code, then it's billed at a higher rate. If a person is not checking their Medicare summary notice, that may go through, or that claim may be paid. So again, it's important to check the Medicare summary notice. Unneeded or excessive x-rays and lab tests. This is if you, for instance, go to your primary care doctor. They do some testing, and then they say, okay, I'm going to need to send you to a specialist. Well, you go to that specialist, they do the same test. If it's within a short period of time, the specialist should be able to use the same test that the primary care doctor conducted. And so it's important to ask that question so that those excessive x-rays or lab tests are not done. On the next slide, it talks about the 3 steps to prevent healthcare fraud. As we mentioned, protecting, detecting, and reporting. So how do we do that? First of all, to protect yourself and others from Medicare fraud, on the next slide, it talks about the do's and don'ts of what you can do. So first of all, treating your Medicare card just like it was a credit card. You do not give out your credit card number to anyone, so you do not give out your Medicare number to anyone. Watch out for identity theft. So that means checking your statements, making sure you always know where your cards are, so that they're not misplaced or they could be stolen. Do be aware that Medicare doesn't call or visit to sell you anything. Medicare is the federal government, and they will not call you. The federal government will never call you. Recently, they have started doing surveys, but they will send you a letter letting you know that the survey will take place on this date. So other than that, the federal government will not call you. Do be cautious of offers for free medical services. Now, you may have blood pressure checks, you may have screenings done at health fairs. If they are truly free, they should not be asking for your Medicare card. So it's important that you do not give out your Medicare number except to your doctor or other Medicare provider. And then don't carry your card unless you will need it. Some people want to keep that card in their wallet in case of emergencies, but it is important to note that if there is an emergency, the emergency personnel must treat you for an emergency without regard to insurance. And most importantly, pass this information along so that others know some of the do's and don'ts in order to protect each of us. In order to detect Medicare fraud and abuse, on the next slide, it mentions a personal health care journal. We do have personal health care journals available. When we go out to do presentations, sometimes we'll be able to provide those, and it lists doctor appointments, it can list prescriptions, it can list maybe any ailments that you're having. So that way, when you receive your Medicare summary notice or explanation of benefits, you can compare that to what you have in your journal. Now, when you review your Medicare summary notice, you should make sure and check to see if there are any services that you didn't receive, see if there is any double billing, or services not ordered by your doctor. And sometimes only you and the doctor will know if it's accurate or not. So we have to be our own advocates when we're looking at our explanation of benefits or our Medicare summary notice. The Medicare summary notices are mailed out every quarter. So you may go to a doctor in January and not see that Medicare summary notice until April. So it's like, okay, how do I know if that's what happened during that time? Well, that's when the personal health care journal comes in, or you can have a notebook and have that information in there, an Excel spreadsheet, whatever works for you to keep track would be helpful so that you can reconcile with your Medicare summary notice or with any invoices you receive from your provider. Since the Medicare summary notices come out every quarter, if you want to see your claims almost real time, you can actually create a account on mymedicare.gov, and probably within a week or two of your visit, you should be able to see your claim and what Medicare has approved, what Medicare has paid, and what you owe. This is if you have original Medicare or traditional Medicare. If you have a Medicare Advantage plan, then you can check with the plan. They may have a patient portal on their website that allows you to do the same thing. And then also, the last step is to report anything that you come across on your Medicare summary notice. The first point would be to call the provider because it could be an error. And so you want to start with the provider, making sure that information is correct there. If you're not able to work with the provider, then you can contact the Senior Medicare Patrol, and we can assist you with what needs to be done in order to report any suspected Medicare fraud and abuse. It's a good idea to gather the information and any documentation you have prior to making any calls. The one thing that will be asked for sure is the date of service. So always know the date of service and any documentation that goes along with that. The next slide is a summary of the Medicare, the new Medicare cards, which we've already gone over. So I will not go over that with you. And just a reminder, the 3 steps to prevent healthcare fraud: protect, detect, and report. And so how can you take charge and help prevent Medicare fraud, errors, and abuse? By protecting, detecting, and reporting any activity. Now on the next slide, it does have a YouTube video. I'm sorry, can you go back 2 slides? There you go. It has a YouTube video. You can actually search for that on YouTube and be able to see a good video that talks about recognizing the bad guys. And it explains how people can come to your door and try to sell you items, asking for your Medicare card, how some older adults were taken on a trip and it was billed as therapy. So there have been various ways that people have tried to defraud the Medicare system. And so it's important for all of us to know what we can do to help protect the trust fund. And then on the 2 slides later, provides our contact information, my direct line, as well as the toll-free number to the Better Business Bureau Education Foundation of Greater Houston that oversees our grant. If you need to report suspected fraud or abuse, if you would like to request a speaker or any materials that we offer, or if you would like to volunteer with the S&P program, we do have training available. It's online. You can take it at your leisure, and we would love to have you join us in order to help protect, detect, and report any fraud, errors, or abuse. And with that, I'll turn it back over to Jan. Are you on, Jan?
Did we lose you, Jan?
We may
Yes,
have
I'm
lost
here.
her.
I
Okay.
didn't unmute. Sorry. So as we come to the end of the information we're providing today, we just wanted to give you more resource information as well as our contact information. So on this overhead, you'll see how you can find the information about the Advantage plans, drug plans, the Medicare handbook, etc. So there are some websites for you there. And then it continues on to a second page with more educational materials. There are two main websites for getting Medicare information. The first one you see there, cms.gov, tends to be the more technical of the two websites. And then on the it's probably on the next page then that we'll see Medicare.gov. There you see it in the heading there. That's the consumer website for information. All of the products are either booklets or pamphlets related to the topics we've been talking about today. So it's nice to know what the product number is so that you can look those up and either download them or order an individual copy. So then finally we want to emphasize the fact on the next overhead that these training materials are based on the Centers for Medicare and Medicaid Services National Training Program materials, and you can join that email list to get that information. We'd also like to provide contact information for North Central Texas Area Agency on Aging. Here you see our address, phone number, and website, as well as a listing of our staff benefits counselors. In addition to the AAA, we also have 3 ADRC, Aging and Disability Resource Center, case managers who are Medicare trained and certified benefits counselors as well. And that would be Brenda Tatum, Denise Adams, and Tyra Clemens. And so they would be available as secondary individuals who could answer Medicare questions for you. So with that, I'll turn it over to Marty to see if we have any questions.
Great. I'm going to unmute you. Hopefully there's not some background noise in case anybody has any questions. But first, I know Jennifer had sent a question. Any tips for best ways to access extra help?
To accept extra help?
To access extra help.
The best way to apply for extra help is to do it online on Social Security's website, and you just click on Medicare, and then just kind of you have to go through a couple of prompts, but you can access the application online. It's much faster doing it that way. You can probably find out in about 4 weeks whether you qualify for extra help. It's probably one of the easiest government programs to apply for. I can do it if I'm talking to a client on the phone. I can do it in about 10 or 15 minutes. Ask them the questions, enter in on the application online, and click submit. And in about probably 4 weeks, they can find out whether they qualify for extra help or not.
Okay. Does anyone else have any questions? Anyone listening have any questions for any of our speakers? Well, that's a great sign. That means you answered all the questions as we went. Thank you all for it. One of the things I need the people that are looking for CEUs to do is now to email me your mailing address where you would like your certificate mailed. And thank you to our speakers. Thank you, Jan, Jane, Melinda, thank you so much.
You're welcome.
I'll have a blessed day.
Thank you, Marty.
Thank you. Bye-bye.
Bye-bye.
Thanks, everybody. That was really good. Thank you.